At the end of March this year, laboratory tests revealed that this 31-year-old who had just returned from a trip to Dubai had contracted the COVID-19 virus. A few days later, as he received his treatment in Kanyinya, as the country planned on how to receive more people that would be arriving, his condition had begun to improve. On April 5th, the young man was still being treated, however. I came with a sore throat, I had a lot of fever and cough, and my entire body was weak. When I just reached here, I wasn't able to eat anything because of the sores in my mouth. When they tested me, they told us that we had to wait and that we would recover soon. On April 14th, the young man was discharged after his tests showed no coronavirus in his body. He says that in the early days, there were some who stigmatized him, but it gradually subsidized. Here at home, they also feared me a bit. I have my room and they said to me they would bring me my food there. But because I was confident that I had healed, I was not ashamed. I continued to live in my room 14 days and after I moved out. Thank God Dr. Ernest of Kanyinya came to visit us with another RBC team who did more blood tests. They took more tests and told me everything was okay with me, that it was okay for me to socialize with people at home, but avoid being out to avoid getting infected again. Those who were already associating with him explained how they first feared him but later changed their perspective. You have to fear them because it's a serious illness as we hear it. But as soon as we knew that someone can recover and we saw the numbers coming out telling us of the people that were recovering, there was no reason not to socialize with the one that had recovered. Although the World Health Organization says there's no guarantee that a person who recovered from the COVID-19 virus will not get infected again, health authorities in Rwanda have confirmed that none of the people who have recovered from the virus has been reinfected. The director of the Rwanda Biomedical Center, Dr. Sabe Nsanzimana, says research into the people who have recovered from COVID-19 is ongoing. Such people that have recovered should not be stigmatized in their families. They should know that at some point their antibodies after the treatment of COVID-19 could be needed to treat others. These people instead should be treated well because through them we could be able to get to treat others. The other thing we are testing now is to see if they have made the body immune to the coronavirus. The first indications we had were that some antibodies that come soon and others come later. There are those who delay and come quickly, and there are instances where one doesn't have the antibodies to protect them but doesn't have the virus. It's also possible. So we will continue to monitor these people to find out their immunity in Rwanda, as it may be different from those in China, Europe or the USA. That's what, as researchers, we're working on and following up. As of the end of last week, there were 237 people that had recovered from COVID-19 in Rwanda, with more than 2.3 million globally.